Hi, my name's Greg Fell. I'm Director of Public Health in Sheffield. This is a situational update dated today, 22nd of December. The epidemiology's turned, and that's really important and that's pivotal. What we've noticed over the past couple of months actually is that following a significant rise in cases in September, that has fallen significantly from about October onwards. Both the whole population 7-day instance and importantly the over 65 7-day instance has been falling pretty quickly. Last week or so that fall has ground to a halt and there are signs it's now starting to go back up, and I expect that will continue over the course of the rest of December into January, and I don't know, I wouldn't want to call the future epidemiology, but certainly the improvements that we've seen over the past couple of months have now stopped. The rate is flatlining at very, very best, and it's beginning to go up, and I think it will continue to go up. Importantly, the incidence in the elderly is rising, and that's always been the group that we worry most about, because that's the group that are most likely to be very seriously ill. Significant numbers of people in hospital, significant numbers of people with really complex and quite serious illness that are having long lengths of stay, which is good for nobody actually, and that had been falling very slowly, but there are some signs that that is also beginning to rise as well. So this is an epidemic that's turned on a coin on a number of occasions, and this would appear to be one of the next turning points. It underscores the importance of the fact that this is a dangerous respiratory virus that kills 1% of people that become poorly with it, and that's not a trivial number, that's really, really easy to spread. And actually, the mortality in serious illness is much higher than 1% in some of the elderly and medically vulnerable groups of our city. So the core basics haven't changed. The things that we can all do to minimise our risk to ourselves, to our loved ones and to others just haven't changed and aren't going to change. Washing hands, keeping distance, wearing face coverings, limiting the number of social contacts you have with people, particularly in enclosed, indoor, poorly ventilated public spaces. That hasn't changed. That will be the same throughout. I've said before, I'll say again, we need to be exceptionally careful about Christmas. Christmas will come, Christmas will go. I hope we all have a happy and safe Christmas, but we do need to be careful and manage the risks of mixing households and household bubbles over the Christmas period. It's fair to say that there's an element of if a large number of people take do the right thing, then we'll keep the spread as low as possible. But if a large number of people don't do the right thing, then that will have an impact. Set against that is the notion of super spreaders. We're fairly clear that 20% of people who have this illness are responsible for 80% of the spread, and that isn't a point about flagrant rule breaking. There probably are some people that are flagrant rule breakers, but it is a point about us just forgetting the core basics of the infection control behaviour that we need to adopt. Super spreading might be biological, but it's also behavioural, underscoring the point, washing your hands, keeping your distance, etc. We can all understand that. It's really, really straightforward to understand that. It's really, really, really important that we all keep to that programme. The most important thing is that if you have symptoms, no matter how mild, seek a test. That's the thing, and then do the things that follow. That's the thing that will break the chain of transmissions, no doubts there. So we can all understand that. We can all take our own risks and understand our own risks, but the difference here is we're also taking risks for others. I might be okay, but the people I have contact with and the people I may spread the illness to might not be okay, and they aren't consenting to the risks I'm taking. So that's really important concept that underlies that. So I will say, have a fabulous, safe and happy Christmas, but most importantly, act as if you are infectious and act as if others are infectious, and be mindful of that. just take care over Christmas and the coming period. So in some ways, I kind of make no apology for being reasonably hard-hitting about this one. As I say, it's a dangerous virus, it kills people. It's worth looking that there is some particularly hard-hitting stuff that is actually quite old now. It's from June that someone referenced for me the other day on social media. Frontline stories from the front line of intensive care, from NHS clinicians, very, very, very hard hitting, not from Sheffield but from elsewhere, but I've no doubt those stories have resonance here. It's worth reading that, because that's what we're trying to avoid. That's always what we've been trying to avoid and what we'll be continuing to try to avoid. And we'll put the references on at the end of the video.